Well, hello, I'm John from the Netherlands, and I think in a second I will have my first sheet. Yes, there it is. It's a bit awkward for me to look at you, and I always have to go back to the screen to do the presentation. Halfway I will have to run to there because I have to do a little demo. Takes about 2 or 3 minutes, and then I'll come back. So I'm out of sight for some time then. So what we're talking about is MPN Journal, which is a self-reported patient data system. And we've seen a lot of talk already about symptoms and symptom tracking, and symptoms be getting more and more important in the discussions with your doctor. It's not just blood values anymore. It's also how are you feeling, how are you doing, how do you cope with your disease. And that is exactly why we have developed MPN Journal. It's an initiative from 3 patients. Dolph is there, Remco is there, and myself. And we started this because we really thought there was the need for something that is helping MPN patients to get in control of their disease. It was globally launched in May without any kind of advertising. So it's running now for a couple of months. And by now, over 800 patients are already using this tool to track progress of their disease. So we are very happy with this number. It's a free app. It helps you to log really a lot of information. So we are talking about personal data. And the background of this is, it's not just for you as a patient to understand how your disease is developing, but it's also for us as a community to get more data about all kinds of aspects. I was very happy with your slides, where you were showing the difference between men and women, for instance, in the symptom burden. And there are a lot of other parameters or characteristics that can be very important to understand our disease better. And this kind of information we want to have. So it's personal data like my gender, age, where do I live, who is treating me, what kind of hospital I'm in, etc. Then there is MPM data, like the driver mutation, but also secondary mutations, the MPM type, are you ET or PV, what kind of mutation do you have, what is your VAF score, your allele burden, what is your fibrosis score when at the moment that you were diagnosed. That's also information we are logging in this app. Then there is a lot of medical data. So what medications are you? We're about logging 30 different medications. Not just the MPN medication, like Ruxo or Hydrea, but also cholesterol drugs, because there seems to be a positive correlation with patients using these kind of drugs and their symptom burden and their disease progression. So we're logging about 30 different medications. We invite patients, if they are on a drug that's not listed, to send it to us, and then we will add that drug to the list as well. We also ask about dosing and frequency and lab results. So our patients can input the lab results in their tool, so they can have a graphical overview how their blood values are developing. Now I have to do the magic trick, like... Oh my God. Can you click the space bar? Okay. Oh. Okay, and then very importantly, we also ask patients to log a lot of data about their symptoms. And these are not just the physical symptoms and not just the MPN 10, but a lot of more symptoms because, for instance, headache is not on there, but we got reports from a lot of patients that headache is one of the symptoms of MPN, so we added it to the list. And also psychological problems, psychological symptoms. Fear of disease progression or feeling overwhelmed, that kind of symptoms. That are we logging as well. And then we ask questions about lifestyle, which is very subjective. But we just ask the question, What do you think about the health of your eating? Is it a 1, which is bad, or is it a 5, or is it somewhere in between? What about your alcohol consumption? If you're smoking, what about smoking? If you're a woman, we will ask, did you have a period, or are you in menopause? Because this can also affect symptom burden. So that's the type of questions and data that is in this MPN Journal app. Why? Why is it good for patients to have this? Well, keeping track of your symptoms and side effects, lab results, in a way, it gives you the feeling of getting more in control of your disease. You know, you are actively monitoring your own progression. What I found, for instance, I thought I was a stable patient with my fatigue, more or less on a 7 or an 8 all the time. But when I started logging my symptoms every day, I saw it was spiking, much more than I even myself realized. So when I come to the doctor and he's asking, how are you doing? First of all, I want to get rid of this question, you know, how are you doing? Answer is okay or tired. Okay, let's go to the blood values. We have to get rid of that. We have to spend more time discussing symptoms. But my symptoms were varying much more than I was aware of, which was an eye-opener to me. And this is important as well. I think the first speaker also mentioned this. If you have an explicit list of symptoms that you have experienced in the past, and you see a trend line in how your symptoms are evaluating over time, then suddenly your discussion with your doctor completely changes. Instead of a generic question, how are you doing? And your answer is, I'm okay, or I feel more fatigued than last time. Now you're discussing a list of graphs, symptom progression, really based on your own experience, logged and ready for discussion. Then, of course, there is always the question, can I do something about my symptoms myself in changing my behavior? What happens if I exercise more? What happens if I lower my alcohol consumption a bit? What happens if I eat more healthy? Those kind of, what happens if I stop smoking? Now I'm looking at a particular person. These are particular, we all have been here. I know that many patients, I was one of them, I kept spreadsheets. What I'm eating, what I'm doing, how much did I exercise, how much steps did I take, just to get an idea of what would be helping me in lowering my symptom burden. So the ability with all these parameters in the tool to see that if I change something here, I see the effect in a couple of weeks, helps you to get in control of your disease better. And then, which has been discussed a lot of times today already, it's very difficult for people wanting to do research or a clinical trial to get access to patients. There are reasons for it, and I understand the reasons, but the hurdles for patients to participate in something is really, really, really high. The ability of researchers to connect to patients has also been regulated in an unhealthy way. It's almost impossible for researchers to get access to patients. So we were thinking, with all these data that we have in our system, and knowing the inclusion and exclusion criteria of pharmaceutical companies or trials to be done or research projects to be done, we could filter out the potential list of patients in our system. We can connect to them and ask them, are you interested in clinical trials? And if so, then we can go to the researchers, present a list of candidates, and they can do follow-up research whether or not they are included in a trial. But changing this around gives a much more empowerment to patients if they would really be willing to and interested to participate in clinical trials. So that's on the patient level. On the community level, if we find correlations over the total data set, then we can indicate promising areas of results. If we see that a particular drug seems to be more efficient within a specific group, I mean, we have 800 now, but imagine we have 8,000 patients in there, all on the same kind of drugs. And if we can find correlations that are interesting, then we can reach out to researchers and say, this should be interesting to follow-up research. I know this is not scientific data, but it gives you indications to start a real scientific project in the future based on our findings. Sometimes there is this question, what is a side effect and what is a symptom? Well, this is self-reported. So if people say, I have a side effect and this is the medication I'm on, I don't know whether or not this is a real side effect, or maybe it's a symptom. Headache is a beautiful example. But if we have these many patients on medications and we can see side effects with one particular drug being higher and lower with another one, then maybe we can get more insight of real side effects of the medication being used. Of course, if we see that people are using drugs or change dose or change medication, can we see that in their blood levels? And not just by doing a test with 25 or 60, even if it's a big one, maybe even 100 patients, but over all the 8,000 patients we have in the system. So we get a better insight of the efficacy of treatment, but also on what helps you in your lifestyle. Can we discover patterns, correlations between lifestyle and symptom burden or disease progression or the lab results that are all stored in this system? And even without all these related correlations, basic statistical information can already be very, very interesting, and I will show you some examples after this. I was in the honor to present the journal in St. Gallen. Thank you very much for the invitation, Rao. That's an event he organized. And I was given the opportunity to present what we were doing. And probably you all know him. He is really well known for his expertise. And he jumped up, took the mic, and supported us, saying, I think this is a fantastic initiative, and he's now helping us by promoting this app, not just to patients, but also in the community. And I'm not sure if I'm allowed to tell you, but in December on ASH, we will do a presentation together to the ASH audience with initial results of what we are doing. So that's very helpful. And then we have another well-known person, also because of his unusual ideas, creative ideas, which is Professor Hasselbach from Denmark. He is a really active supporter. All of his patients are using now MPN Journal, but he's also offering us support and resources to implement machine learning and AI on our data set. So that's something that he can bring to the table, which is very, very, very helpful. Now, if you want patients to log everything here on a preferably daily basis, I mean, you can choose for daily, weekly, or then you have to be sure that the tool that you are providing is easy to use. So what we have done to do that, you never have to remember your email, the URL, or whatever. You sign up, you get an anonymous email address, and every day you get an email on the time that you prefer. There's a link in there, you click the link and you're in the tool. It's as easy as that. So we take away that hurdle. It's web-based, so you don't have to download something, you don't have to install something. We just found out that I didn't have a PC here, so I will have to go there and run it on his PC. Never installed anything there. And as you will see, hopefully, it will all work. It's anonymous. This is very important. We had a big hack in the Netherlands where hundreds of thousands of women data about breast cancer research was put in the public. And it was very well protected. And still hackers were able to break it and asking for millions of dollars. Otherwise they would publish these data sets. So what we've done is completely different. We completely separated identifying data from all the medical data that we are storing. So even if we are hacked, there is no problem, because one system gives them a list of email addresses without anything else, and the other one gives them a set of data without any identifying data in there. And by splitting this, we have a secure system. We have a dashboarding system where you can have graphical overviews of how your symptoms and other aspects are progressing. And very importantly, it's all in native language. There are many tools in there, MPN 10, etc., but it's either English or in your only one language. We want to build up a data set from all over the world, and therefore we committed ourselves to translate everything in that tool in every native language necessary. So the ones here are added because the PAG of that country has asked to participate in here. If there are any other countries joining, then we will add translations in their native language as well. So this is technical, I will skip it. So typically registration takes about 7 minutes, because we're going to ask a lot of questions about your age, where do you live, what's your medication, how often do you use it, etc. And that takes about 7 minutes to complete. However, once you're registered in the system and you do your daily updates and nothing changed, then it will only take 1 minute of your time every day. And that's it. If there is something changing, for instance, you had an event or your treatment goal changed or your medication changed, then you get additional questions, but only if something changed. If not, you're done within a minute. And participants can choose to update daily, frequently, or monthly. And I think now I have to go there. See you in a minute. Okay, so for the people in the back, so this is what happens is you receive an email, you click on the link, and this is where it brings you. So this is the update of the MPN Journal on a daily basis. Then typically we will start with a message, could be some news or something else. I will come back to Everyday Better Challenge, but that is something that people can participate in, so this is a news item that we change regularly. And as you can see, everything we do is in a chat way, guided interaction. So you don't have to fill in any forms or go to a website. You just answer the questions, and then it follows you through the application. So we start with a number of questions asking, has something changed? So if they found a new secondary mutation, or you have a new treatment, or a bone marrow biopsy, if you click that, you get follow-up questions about that. If there is nothing changed, you just click no changes, and it brings you to the next question. And this is a point where I want to relate to the privacy and anonymity as well. We all know that sometimes you skip your medication. At least that happened to me last night. But I'm not sure if my... no, it wasn't the drinks. I'm not sure, with a lot of questions, if I would be always open and honest to my doctor if he asked these kind of questions. Now, knowing this is anonymous and nobody else can see this kind of data, at least not reflected to me as a person, I can be honest and open to myself about this. So I would say today, moderately, I occasionally missed or taken my medication not in the proper way. Then I get a list of symptoms, or sorry, a list of side effects related to my medication. So there are quite a lot there. And these are all side effects that people have been reporting to us. Now, sometimes I have a side effect of inflated gums, probably because I'm on Jakavi. So if I select that and go next, it will ask me about the severity of this side effect for me personally. Now, let's say it's a 6 out of 10. And then we come to the MPN questions. The symptoms we are all familiar with. That is fatigue, night sweats. The MPN 10 is in there, but as you can see, the list is much longer than just MPN-10, because we know there are patients with neuropathy. We know there are patients with tinnitus. We know that there are patients with cramps, restless legs, headaches. These are all not listed in the traditional MPN-10. If there is something that one of your symptoms, then you click fatigue and, for instance, whatever, cramps, the ones that I typically can have. Again, you get 2 follow-up questions about the severity on a scale of 1 to 10. So my fatigue today is excellent, only a 3. And I had muscle cramps for a 4. Then, next question is about psychological symptoms. I will come back to that later, but you can discuss here, or you can enter here, I feel overwhelmed, I'm afraid of dying early, I'm afraid of the side effects of my medication, I'm afraid that my MPN will get worse. And I was really surprised by the amount of people that clicked any of these 4 options, as I will show you later. This is a place, if there is a symptom or a side effect that's not in our list, you have here the opportunity to add it. We will count the number of times this is being reported, and if we see this occurring more often, we will add it to the list. And then we get 6 questions, or 5, depending on whether you're a man or a woman, about your life balance. So this is about the balance of your eating pattern. I went out for lunch, for dinner yesterday, so I give it a 4. Physical activity is used to be very high for me, but now here on this congress it's only a 1. Then there is a question about sleep quality, which is also sometimes impacting symptom burden, so it's a 5. Stress level, no stress. And alcohol consumption, I need to be honest here, I give it a 2. Have you weighed yourself in the past period? Yes. My weight is now 75.2. And do you have any other comments or questions? This is for your personal storage, so this is information that you want to store in your journal yourself. And that's it. So it took a little bit longer now, but in real time, the clicker is there. In real time, it only takes a minute to complete.
Regarding the weight, very important to add the weight
To
compare people who forget to do it.
Yeah, there was interesting. The reason, this was because of Hasselbalch. He had done some research on obesity or BMI and symptom burden, and there was a correlation. So then he asked us, can you add it to the, and that's why we...
But it's also important to with the follow-up.
Yes, absolutely. I forgot to show you the graphs, sorry. Maybe if there's time left, I'll do it at the end. So I will come back to the end and show you a little bit about the graphs in there. But let's first focus on something, the potential of the data we see here. Some of the data is old. It's only from July, since the talk I had in Switzerland. Some of the data is new because we wanted to have an update. So don't look at the numbers particularly, but look at the potential of what I'm showing here. Of course, there is age distribution. Now, we can use this kind of graphs to compare it to statistical data from scientific research, because then we can see if our population aligns with the general population. You could argue that maybe older people are not willing or able to use apps. Well, that's not the case, because our age distribution is more or less equal to the normal age distribution. Type of MPN is another such question. Type of mutation, so these are the mutations being inputted by the patients in MPN Journal. This is the allele burden. this is the distribution of physical symptoms among patients. So as in the other sheets that you've been showing, you will see 75%. I immediately made a note to myself, we have to distinguish men and women here, because that yours was more powerful than mine. But you can see that all this kind of information helps us to get an overview of the symptoms that patients have. Now we come to an interesting one, and that is a distribution of psychological symptoms. And I was shocked, to be honest. What you see here is that 50% of patients indicate that they have fear of progression. Fear of progression from PV to MF, fear of progression of MF to AML. And I was not expecting that a high number. It's even if you look at almost 18% of patients have fear of dying, fear of side effects. They're really high numbers. And there is nothing being done in the treatment of these symptoms. We're all talking with our hematologist about our blood values and our symptoms, but this is never addressed, typically. Now, if you break this down, as you saw, if you put something in there, you have to score it. So it matters whether or not you give it a 1, as my impact on my daily life, or a 10. I mean, then it's occupying everything you do. And if we look here, then we see that 25% of those patients rate this an 8 or higher. So the fear of progression, ask what is the impact on your quality of life daily? They rate that with an 8 to a 10, which is extremely high. And these people should get support with this. Not just look at the blood values and the lab values. These people need support. Then, of course, we have a long list of medication, and this distribution is very interesting, of course. We also report side effects among patients. And again, we don't know if these are real side effects. These are the side effects that patients think they have with the medication they are using. We know for each patient what medication they are using, so we can do cross analytics and see what side effects are related to which symptoms. Reported side effects. I want to say one depression. There is a lot of discussion going on here. It's quite low as a side effect. And so we did a deep dive yesterday in the data, particularly with respect to interferon. And as far as we can see right now in the data that we now have, let's be careful, the effect is not hardly as big as everybody is saying. When I was diagnosed and put on Hydrea, and I had looked into this some scientific information, I was asking, I don't like to be put on Hydrea, I prefer interferon. And the answer of my doctor was no, because there's this huge risk of depression. And I said, come on, I am not going to be depressed. He was refusing it, so I switched doctors and I got interferon later. But this misunderstanding of, it is a side effect, but it's not really typically, it doesn't seem to occur more often with interferon than with any of the other drugs. Then we have clinical events. We're not running for a very long time, so the numbers are quite low at this moment, thankfully. And then you see the number that is interested in participating in clinical trials. Right now it's up to 90% in the latest data. So 90% of patients indicate, yes, I would be willing and interested to participate in clinical research or trial data. This is an interesting one as well. So one of the questions we have added to the system is, how was your MPN diagnosed? How did you learn that you have MPN? And 20% of people said that was because of an event. I had a heart attack, I had a stroke. We're all too late here. 20% of people should have been diagnosed earlier to prevent everything that they have experienced. So this is a clear indication that there is much to do still well, especially in your country, I think. You know, the reason for underdiagnosis is, this is the consequence of underdiagnosis. This is an interesting one. Let me not go into details here, but because the numbers that I'm telling you are not here on the screen, but it has to do with how you correlate this information. Almost 15% of patients have a family member with MPN. And we all learn it's a mutation you acquire in life. It's not genetic, it's not inherited, but we see that there must be, and that's why I asked the question this morning, in the beginning of the afternoon, could this MDM2 maybe play a role? If that is genetic, maybe that's the reason why more patients have familiar relationships than was expected. I mean, the typical, we say, between 1 and 3 persons in 100,000 get MPN. Then if it's not genetic, how come we get 14% or 15% of patients with a family member, being a brother, a mother, a father, or a nephew? You know, this is awkward. So I think this calls for more research. And then we can try to do something with AI. So we see patterns that we would never think of to finding ourselves. Like, for instance, we see everybody with itching has fatigue. In our system, there is not one patient with itching who is not also reporting fatigue. So maybe there is a common cause here. Weight loss. So that is unintended weight loss. This is not weight loss because I'm exercising, but this is weight loss because my body is not able to store energy anymore. It's much less reported with patients with a lot of exercise and low stress levels. I don't know what it means, but it's an interesting correlation. High allele burden strongly correlates with high dose of ruxolitinib and hydroxycarbamide, this hydria, which makes sense in a way. But strangely enough, we don't see this with interferon in the same correlation. And all patients reporting weight loss also report fear of progression, which typically makes sense, I think. Besremi or any interferon does not increase risk on depression, coming from the data. And interestingly, more exercise seems to lower fatigue symptoms. And this was one that was triggering me, especially. I keep warning, this is not validated, this is showing the potential, don't write this down, don't tell to your other patients you should do this and it's proven that, no, this is showing the potential. And then looking into the data, we also see a correlation between symptom burden and healthy behavior. And so I reached out to Hasselbalch, asking him about what do you think about this. I asked the same question to Ruben. I asked the same question to my physician. I asked the same question to Rao in here. And they all say there is a relationship. If you live healthy, decrease sugar, increase your activity level, your symptoms will go down. Even your disease progression might be positively influenced. And then when we wrote an article in our magazine in the Netherlands, suddenly I got a lot of pushback from hematologists saying, this is a false promise, because there is no scientific evidence that this is really true. And it's irresponsible that you are showing to your patients that this might affect their symptom burden. And then we get a huge discussion. So, what do we do about that? Oh, sorry, show my data first. Then I don't have to show the sheets as well. So this is my fatigue. And to give you a little bit of background, I was in the opportunity to do a ski holiday, winter sport holiday for 3 weeks in a row. And I had my usual fatigue. But being on winter sport and skiing is my favorite thing, so I don't matter, whatever happens, I go skiing and all day. And then I noticed in my journal that my fatigue was slowly going down. So I said, okay, I keep on doing this. So I started exercising for at least 4 times a week. And I am symptom-free at the moment. So from high level of fatigue, I'm completely cured from my fatigue, which is my personal story. But then I told my story to Remco, and Remco said, Remco is a more stable patient and he has more problems than I have, also at a higher level. And he said, and that was around there, and he said, for me it doesn't work. I tried it, I start playing badminton again, but in a way it's not helping. So I said, yeah, okay, maybe for you something else helps. And then, by accident, when we were developing the tools, I saw his graph and I noticed this. So I said, Remco, what's going on? Why are you improving? Yeah, I forgot to tell you. I'm exercising and it slowly starts to work. So even for Remco, this appeared to work. Now Remco, we had a meeting as well last week or so. And I said, how are you doing? To be honest, I'm not exercising anymore the way that I should. And then I'll come back to that later. Then we have Mona here and Joachim. And Mona has been on this conference more times with a reading of the man behind her, explaining why sugar intake is not good for MPN patients. And she decided completely change her behavior. So she started walking every day. She has a very busy job. She works for herself. She also is helping her mother, I think, with all kind of medical problems. So she's a caretaker. She lost 12 kilograms. And she doesn't need any rest moments anymore. She has stable lab results. And now she's even discussing with her hematologist to lowering her medication dose. This is just one example. Joachim, exactly the same. He is running ultramarathons right now. He's a PV patient with a lot of problems, he decided to change his diet as well, and he's running ultramarathons. Now, these are all examples, and there is no guarantee that anything of this will help you. But we were thinking, come on, this is not coincidence. So what are we going to do to find out if this also works for other patients? So we came up with the idea to start a challenge, a 30-day challenge, where people are invited to change their lifestyle behavior for 30 days and log their progress in MPN Journal. Again, it's free, it's anonymous, you don't need a browser, you don't need to download, you can click the link and you can join. And also this is available in 12 languages. And we do this in cooperation with House of Hamster. This is a program that takes into account that it's very difficult to start something like a diet or change your behavior and keep on doing this. This is why I was mentioning Remco as an example. And it's not because he is weak. It's because there's something in our brain that's causing this. And I have one video that shows you, and if you click on the picture, please. Can you click on the picture? No, anywhere on the...
Hello, my name is Felix Kreier. I'm a pediatrician, obesity expert, and neuroscientist. Talking about challenges. Everybody wants to live healthy and have a healthy lifestyle, but it's so difficult. Why is it that difficult? Why is it always easy in the beginning to change to a healthy lifestyle, but so difficult to maintain? It helps to know something about the brain. And during our hamster brain program, you will learn how it works in the brain. There are brain areas which are interesting for this. The first one is the hypothalamus. We call it the hamster because the hamster is really old, billion of years, and always afraid that you might die because you don't have energy anymore. So he's always afraid that you don't eat enough, even better to eat a little bit more. And he doesn't know yet that there are supermarkets and fridges where always food is available. We are not made for overflow and having food everywhere all the time. So this is the driving force behind this desire to eat unhealthy, which is basically a lot of calories, sugar and fat. Not to move too much because you shouldn't use energy because you need the energy reserves, because the hamster expects that there's no food for a long time within a short period, like maybe next week. So this is one area. And then we have the prefrontal cortex, which makes very wise decisions and decides to live healthy and can control the hypothalamus a little bit. But the problem is, the special thing about the prefrontal cortex, which is in the front of your brain, is that that area is not a multitasker. It only can focus on one thing. So everything is fine as long as you just focus on that one challenge. But that's hard because at a certain things you have to solve all kind of private or business problems. And then you need your prefrontal cortex. And then the brake is loose from the hamster, from the hypothalamus. And the hypothalamus will take back what he lost. So if you lost 5 kilograms, you will get 5 kilograms back. And just to be sure, 5 extra. That's called the yo-yo effect. In this program, you will learn simple tricks how to overcome this limitation of the prefrontal cortex. It will help you to master your hamster, and it will helping you to maintain your healthier lifestyle for a much longer time and with more ease. Looking forward to see you at the challenge.
Hello, my lovelies. It's Susanna, and today I want to show you the basics of how to work with integrals.
Oh, there could have been another video. So, spread the word. Use it yourself, but also if you're a doctor, try to convince your patients to start using this. So we can increase the number of patients, and by doing so increase the insights that we are getting. So we started this promotion on the 30-day challenge on October 17, so it's a really short time. We have leaflets printed to physicians worldwide, and we had campaigns on LinkedIn, Reddit, MPN World, of course, and 14 MPN PAGs. We started on the November 1st, and already 220 patients are doing this challenge. And this program is based on this hamster methodology. So it's not a diet, it's not a fitness program. You know exactly what you have to do, probably. The hamster program is helping you to keep going on with this healthier behavior for at least this period of 30 days. And we hope that after 30 days you will find some results, and we hope that you will continue to live healthier, and we hope then to be able to show and prove that healthier lifestyle really affects symptom burden. Are there any questions?
Is there any room on this portal to sit?
Oh, I'm going to wait for the mic.
Hello, everyone. My name is Melissa. Happy to be here. Thank you very much, John, for the presentation and all the work you put on. My question is, if we have suggestions of other kind of data that you we think that maybe would be important that we could add to this journal. How would we go about that? Do you have just the
Well, maybe-
email?
Take one of these.
Okay.
Send it over. If it's interesting, we will certainly add it. I mean,
Right.
if you compare the MPN Journal as it is now and compare it with 3 or 4 months ago, it's much more wider already. So of course, if there is any suggestion that will improve the quality, then we will add it.
From my experience, I've been working also with a nutritionist, and we've put together sort of it's called a anti-inflammatory list
Yeah.
of foods.
I know.
And we also saw a lot of correlation, which was positive, also giving more energy. So I think keeping a journal of what we're eating and maybe if the food is processed or not, if it's raw or not, I think that's also important. And then also to know what alkaline foods are versus acidic foods and anti-inflammatory.
The problem here is the following. I have the same question with exercising. Do I do HIIT training, endurance training, durability training, stress training, whatever? We have to make sure that the list is not getting so long that people are not able to enter this data in 1 minute anymore. Because if you have to answer these questions every day, over and over again, and the list becomes too long and it becomes too much to enter, then we will lose people in doing so. So we have to balance this out, but I surely like your suggestion to have more detailed information about insights.
Like maybe a group of like anti-inflammatory foods
Yeah,
versus inflammatory
exactly.
foods. Not the whole detail, but just group
Let's
it.
discuss it, because I'm open to add. Yes. Okay, thank you very much.